Alright, I hope you guys can see this well enough. I've already done this one time, and the sound was all messed up, so I'm going to try it again. We're moving into the leg, so I wanted to kind of give you a quick overview of the abdomen using this model. He's the guy with all the blood vessels on him. And then show you some of the leg vasculature as well. One thing also this guy has up on his head, I know we're not really doing head, but the back of the head kind of goes along with the neck, is you can see the occipital artery and vein here. So here's his occipital bone, occipital artery and vein. That's pretty straightforward. All right, looking at the abdomen, let's start with a rundown here. Here's our abdominal aorta, inferior vena cava. We can see our unpaired branches off the abdominal aorta, celiac trunk, superior mesenteric artery, inferior mesenteric artery. It also has one of the paired branches, which is your renal. So this would be right renal artery, left renal vein, right renal vein. If we look closer at this area here, you can see your three branches off of the celiac trunk, 1, 2, 3. So this is left gastric, splenic artery, and this is common hepatic artery. Now you're not going to find all of your branches here, so this common hepatic just goes straight over to proper hepatic, which then is going to give rise to right and left hepatic artery. You can also see your splenic vein here coming across. You can't really see it all the way here, but you know it's going to come together with your superior mesenteric vein, which is here, and give rise to your hepatic portal vein, which is going to enter the liver. You'd also have an inferior mesenteric vein coming up this way. Here we can see the venous drainage of the liver. Now remember, blood enters the liver through the hepatic portal vein and is drained through those sinuses into the central veins and ends up in the hepatic vein. Not hepatic portal vein, hepatic vein, which is here. Then that hepatic vein dumps into the inferior vena cava. Now as our abdominal aorta descends, it's going to split into your right and left common iliac arteries. Remember, common in the name tells you that this vessel is going to split. So common iliac artery splits into internal iliac artery, external iliac artery. So here's left common iliac artery, left internal iliac artery, left external iliac artery, and you can see the veins as well. Common iliac veins, external iliac veins, internal iliac veins. External iliac artery continues down, passes underneath that inguinal ligament, becomes femoral. So this would be femoral artery and femoral vein. And on the other side you can see your femoral artery well here. Femoral artery gives off some branches. One of those is lateral circumflex femoral, which has an ascending and a descending branch. So lateral circumflex femoral ascending, lateral circumflex femoral descending, and here is your deep femoral. Deep femoral is going to give off perforating branches, which are these small branches going into the muscle. Femoral artery will continue down, go through the adductor hiatus, go around the back side of the knee, becoming popliteal. Popliteal artery will give off 4 genicular arteries around the knee. So we have our superior medial genicular, our inferior medial genicular, our superior lateral genicular, and inferior lateral genicular arteries to feed the knee joint. Then it's going to give off anterior tibial, which on this model you can see on the right side going down the tibia, and posterior tibial here. Posterior tibial will give off another branch that will feed the lateral aspect of the leg, and that's your fibular artery. Anterior tibial artery will continue down across the malleolus, where it's called dorsalis pedis. Continue down into the dorsal aspect of the foot, give off an arch called arcuate artery. Off of arcuate artery you will have metatarsal arteries, dorsal metatarsal arteries, and then you will have your dorsal digital arteries. On this one you can also see your dorsal venous arch here. On the medial side, your great saphenous vein, which will run all the way up and dump into femoral vein here. And on the lateral aspect, you have your small saphenous vein, which will come up, dump into great saphenous, and then take blood back to the femoral vein again. And I think that that is pretty much all you can see on this guy.